Hello, my name is Murray Hawkins and I'd like to introduce you to a very simple, inexpensive but very effective little device which will attract hundreds of new patients to your practice. 1 in 4 patients fear injections and between 5 and 15% suffer from a condition called ballonophobia, a phobia of injections so strong that it causes them to delay treatment until they are in absolute agony. Imagine the effect on your practice if you were the only dentist in your area who could actually treat these people effectively. Imagine just how loyal these patients would be. For the last 5 years I've been using this little device. It's called Vibraject and it's a little vibrator which attaches to a standard dental syringe. When you give a patient an injection using Vibraject, the brain receives 2 messages in quick succession: the buzzing sensation from the Vibraject and the sensation of the needle piercing the gum. It seems that the buzzing sensation arrives at the brain first, probably because it is carried on thicker, better insulated nerve fibres than the thin fibres which transmit pain messages. The brain has difficulty processing 2 images which arrive almost simultaneously. It's like trying to turn your head in 2 directions at once. You just can't do it. The patient only experiences buzzing. Let me show you the system in action. Now Sue, I'm going to numb your tooth up using a revolutionary new system called Vibraject. I'm going to put some anaesthetic jelly on your gum and then I'm going to numb the tooth up. All you will feel is a buzzing feeling. You won't feel any pain. What flavour would you like for your anaesthetic? I can give you amaretto, gin and tonic or Cointreau.
Oh, amaretto, please.
Amaretto. So I'm going to put the amaretto jelly on your gum. And I'm just going to put a cotton wool roll over that for a minute. Right, I'm going to take the cotton wool roll out now. And I'm going to numb the tooth up. You're going to feel a vibration, a sort of buzzing sound. And half close your mouth please, Sue. I'm going to pull your lip nice and tight. There we go, we're in. And we're going to put some anaesthetic next to this tooth. There we are. Well Sue, how did that feel?
Fine. Didn't feel a thing. That was much better than an injection.
Well, I've got to let you in on a little secret, Sue. You did have an injection. You just didn't feel it because we had this little buzzy thing called a Vibraject attached to the needle. And when we turn this on, all you feel is vibration. It's as simple as that.
Wow, that's amazing.
Listen to what these patients have to say about their experiences with Vibraject.
Well, the first time I had Vibraject used on me at the dentist, I kind of wondered what was happening because I literally couldn't feel a thing. And I sat back ready to have the injection prior to the work commencing. And I was aware something was buzzing in my mouth, but other than that I couldn't feel a thing. And I literally was there with my mouth open thinking, is he going to do anything? Is he going to do anything? And then moments later he said, right, you're injected now and you'll numb up nicely. I was quite surprised. I really can't believe that every dentist doesn't have this because it's such a wonderful tool and completely pain-free, and the fear of the dentist is pain, and if you can take that away you've got to be a winner.
Yeah, I'm diabetic and I have to inject myself 7 times a day and I'm okay with that now. It's just dentist injections I really don't like. I was very nervous because I've always been scared of the dentist. I always think it's going to hurt, but then I didn't actually realise it was happening, and then you said you'd finished and I was like, oh. I asked to see what it was and you said not till after, and then when I saw it I realised there was a needle, but if you hadn't have shown me I wouldn't have known.
I would class myself as a needle phobic, and at times I've actually felt like passing out when I've had other injections. If I'm honest, I was a little bit nervous because obviously it was a new procedure, but once I was led in your chair and the injection was done, I was absolutely amazed, didn't feel any pain whatsoever.
Do you think you could ever have an injection again without Vibraject?
Being a needle phobic, I would obviously opt for the Vibraject. To be honest, I would do anything to avoid injections.
When you came in for your checkup earlier on this week, you had a little baby tooth that was bothering you, didn't you?
Yeah.
And when I did your checkup, I said everything's fine. and you said, could I take your tooth out using my little buzzy thing?
Yeah.
Is that right?
Mm-hmm.
Had you had the buzzy thing before?
Yes, I had once before.
And you felt happy enough just to ask me to take a baby tooth out there and then because it hadn't hurt before, is that right?
Yes, it was really quite enjoyable.
It was enjoyable?
Yeah.
Well done. And what does it feel like?
It felt really quite relieving.
I think it should be, it's so beneficial and effective, it should be used right across the board. Yeah, I really do think more folks should use it because it does put the patient at ease. It takes your mind off of what's likely to happen, and to be honest, the procedure's over before you're even aware of it. In fact, it's such a good product that I think they should use it in hospitals because I'm sure it would have a beneficial effect for many other procedures.
That's what patients say, and it's certainly backed up by my clinical experience over the last 5 years. But is there any scientific evidence to prove that Vibraject is effective? Queen's University in Belfast put Vibraject through a clinical trial on 400 patients. Those treated by Vibraject had a mean pain score of 1.7 out of a maximum of 10, whereas those given standard injections had a mean pain score of 4.6 out of 10. That's nearly 3 times as high. Is Vibraject as effective as more expensive rival systems such as the wand? It seems so. A study by Quanstron comparing Vibraject and the wand showed no significant difference in pain perception using the two systems. Vibraject is easy to use and easy to transport. There are no bulky benchtop units, foot pedals or leads. There are no consumables to dispose of after each delivery, and it costs less than £400. I cannot think of a single reason not to use Vibraject. If you want to know more, just go to vibraject.co.uk. You can purchase a product online or by telephoning 01747 826 222.